Thank you very much. I appreciate it. Good morning, everyone, to the October meeting of the Board of Access Health. It's great to see you all. Marcin, I think we need to start with a roll call of the directors who are present, and then an introduction of the officers present. Am I right?
I will do that, sir. But before that, I will just say that this meeting is being recorded for the minute-taking purposes, as well as posting of the recording on the agency's website. This meeting is also being live streamed on the Access Health CT website. With that, I will call for the attendance. Charles Klippel, Chair.
Here, thank you.
Paul Philpott, the Vice Chair.
Here.
Thank you. Dr. Brian Ritter.
Here.
Dr. Dietrich Gifford.
Here.
Steven Hernandez. Matthew Brackman. Thomas McNeil. Andrea Barton-Reeves, DSS Commissioner.
Here.
Thank you. Sean King, OHA.
I'm here.
Claudio Galtieri, OPM.
Here.
Thank you. Paul Lombardo from Connecticut Insurance Department.
Here.
Thank you. Dr. Manish Sutani, the DPH Commissioner.
Here.
Thank you. Caroline Zambetti, designee for Nancy Navarrete, DMS Commissioner.
Good morning, here.
Good morning. Thank you. That concludes the list of participants.
Thank you, Marcin. If I could also ask the staff of the exchange to introduce themselves.
Good morning, all. James Michel, the Chief Executive Officer for Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Rebecca McClear, Director of Technical Operations and Analytics, Access Health Connecticut.
Susan Rich-By, Director of Legal and Governmental Affairs, Access Health Connecticut.
Caroline Rouette, Director of Marketing, Access Health CT.
Good morning, Glenn Jurgen, Director of Human Resources, Access Health Connecticut.
Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Greetings all. Janelle Maloney, Director of Information Technology. Thank you.
Charlie, this concludes the introduction of the staff.
Great, thank you very much. Marcin, I understand that we had no public comment today. Is that correct?
That's correct, Mr. Chair.
Fantastic. So we'll move on to the agenda. And the first item on the agenda is to approve the minutes from the last meeting. Are there any questions or comments or corrections to the minutes from the last meeting? All right, hearing none, I am going to assume no discussion. Could I ask a motion to approve the minutes from the last meeting?
Motion to approve. This is Grant.
Thanks, Grant. Second.
This is Commissioner Reeves.
Thanks so much. I appreciate it. Marcin, I think I leave it to you to take a vote on this.
Yes, Mr. Chair. Charles Klippel.
Yes.
Paul Philpott.
Yes.
Brian Ritter.
Yes.
Dietrich Gifford.
Yes.
Steven Hernandez. Matthew Brackman. Thomas McNeil. Andrea Barton-Reeves.
Yes.
Sean King.
Yes.
And Claudio Galtieri. Mr. Galtieri?
Yes. Yes.
Thank you. Thank you.
All right, thank you all very much. James, the floor is yours for a CEO report.
Thank you, Mr. Chairman. I'll be very brief. Good morning. Again, I'm James Michel, the Chief Executive Officer for Access Health Connecticut. I hope you are all doing well, and thank you for being here this morning. Before we begin, I want to bring your attention to a few important things going on at Access Health. First and foremost, we have hired a new Director of Finance. Her name is Holly Zwick. Holly comes to us with extensive experience in financial management. She is scheduled to start next Tuesday, October 24th. We look forward to introducing her to the board, and we're also very excited to welcome her to the team. Secondly, we have begun our leaver survey, of those people affected by Medicaid unwinding who have not enrolled in a health insurance plan through Access Health Connecticut. Our LEVA survey is designed to gather honest feedback from customers about why they are no longer enrolled in Medicaid coverage. We were able to secure a grant to cover the entire course of the survey from the Connecticut Health Foundation. As I mentioned at our last board meeting, the survey will allow us to gather information to find out why these individuals are not enrolling. And we will share the results of the survey with the board as it develops. The main focus of today's meeting will be on a consumer impact study that has been completed by Weekly Consulting. And also we'll give you a brief update on our preparation for our 11th open enrollment. Regarding our meeting today, we'll begin with an overview of our open enrollment period. We are well prepared for the upcoming open enrollment period, which begins on November 1st and runs to January 15th, 2024. Katie Hearn, our Associate Director of the Enterprise Project Management Office, will give a technology update. Caroline Rouette, our Director of Marketing, will share our marketing initiatives for the upcoming open enrollment period. And Tammy Hendricks, Director of Health Equity and Outreach, will review the community outreach plan through the open enrollment period. Then we'll close out with Julie Andrews of Weekly Consulting, and she will provide us with a recap of the customer impact study. Again, these are the proposed rates for 2024 and their impact on our customers for next year. Earlier in the week, we emailed you a brief ACA legal update from Susan Richby, our Director of Legal and Government Affairs. If time permits, Susan is ready to answer any questions you may have from her memo. Thank you for your attention and continued support. I will pause now for any questions.
Thank you, James. I appreciate it. This is an important meeting to talk about open enrollment, so let's get right to it. Thank you.
Thank you.
Oh, I'm sorry.
Thank you, James.
Yeah, there we go. Perfect.
Thank you, James. Good morning. My name is Katie Hearn. I'm the Associate Director of the Enterprise Project Management Office. Our office is currently tracking more than 20 projects. We're very focused now on preparing for Open Enrollment 11. We're on track for OE 11 to begin on November 1st, as it does every year. And just as a reminder, this year it is expected to run from November 1st through January 15th. And I have some readiness updates to share with you briefly as well. This is the first open enrollment in which Infosys will be responsible for the maintenance and operations of the enrollment system. This means that Infosys will be responsible for running projections and auto renewals for the 2024 plan year, for example. Also, importantly, Infosys will be responsible for maintaining our system infrastructure. Infosys fully transitioned to this role as of October 1st. Deloitte continues to be responsible for enrollment system releases, which include changes and any enhancements to the enrollment system. The EPMO has 2 project managers working to prepare for open enrollment and to track open enrollment this year. We are tracking operations activities and systems tasks very closely. Also, consumers who are eligible to auto renew into qualified health plans for the 2024 plan this year will be notified by the end of November. Consumers seeking a January 1st effective date for a 2024 qualified health plan must enroll by no later than December 15th. And consumers who enroll between December 16th and January 15th will receive a February 1st effective date. It's just important for consumers to keep that in mind as we approach November. Also, I wanted to highlight that this will be the first OE in which auto renewals for the individual dental plans will take place within the enrollment system alongside the health plans. We're expecting that dental auto renewals will be helpful for dental enrollee retention this year. So we're excited about that change. And we also have a connection now between our enrollment system and the National Change of Address Service from the post office. This will be able to indicate to us anyone who has recently moved, and that in turn should aid in reducing the volume of returned mail with our notices and so forth. And also an auto enrollment option is now available in the application. Those losing Husky Health coverage who opt in and who qualify for the Covered Connecticut program will be auto enrolled into the program. This is brand new this year. Our training and broker support departments are now administering and assisting with the annual Access Health CT online certification. We offer online training every year to staff, to our community partners, which include brokers, certified application counselors, and navigator organizations. And finally, this OE, we have a brand new public enrollment dashboard, which will be displayed on our website. It will display health and dental coverage enrollment statistics, enrollee demographic, and retention data, as well as broker data. Thank you.
Terrific. Before we move on, any questions? One comment, which I'm going to echo Commissioner Gifford's comment, which is it's great to see the auto enrollment for Cover Connecticut. And James, I understand we've had quite an uptick in Cover Connecticut enrollment, which is great to see as well.
Right. Right now we are approaching 21,000 Cover Connecticut enrollees. And again, yes, this is transition from unwinding to us. So we think the numbers will continue to climb as we continue to execute the unwinding strategy.
So congratulations to all the technology folks who put that together. That is terrific. Thanks.
Thank you.
The marketing update, I believe, is next.
Good morning, Caroline Rouette here, Director of Marketing at Access Health CT. We will begin our open enrollment readiness marketing report with some information about some special audiences that we need to communicate to this year. So in terms of our direct-to-consumer communications, the channels that we have to reach them, as a reminder, is direct mail, email, and text messaging. Direct mail is all that we require of folks, so that's the best way that we can reach the totality of our audience. And then if people opt in, we can reach them via email and or text messaging as well. So in terms of the messages and audiences that we need to reach, we have two different categories. We have our retention category and the acquisition category. In retention, a special audience that we regularly reach out to is our renewal customers and letting them know that they either will be auto-renewed or whether they need to take some manual action. So we'll be reaching out to them. The board also talked to us about an audience at the end of last year's open enrollment, which we have addressed in the past and we will continue to address this year. And those are folks who are potentially opting to enroll in a plan that does not give them the best financial help options that may be available to them. So what I mean by that is maybe folks who are enrolled in a gold plan or a bronze plan, but they are eligible for cost sharing reductions. We want to reach out to them during the open enrollment cycle where they still have an opportunity to change their plan selection and get that financial help. So we'll be reaching out to those folks too. In addition to that, there are some significant changes to the plans within the Connecticut Insurance Company, Inc. offerings this year. So those folks who have opted to auto-renew will have changes to their networks. And so we want to make sure that we reach out to them. And if they want to come in and make a manual renewal so that they can choose a potentially different plan or at least review their network within the most similar plan this year, that they make an informed decision. And then moving into our acquisition audiences, we know that we're working collaboratively with several stakeholder groups to make the unwinding 2-month premium assistance possible for folks. So as that comes together, we're going to be adding that messaging into our unwinding direct mail, email, and text messaging that's already going out. So we'll be making edits to those communications to include that information. And then lastly, the family glitch. We know that this was fixed last year, which is excellent, and we were really excited about that. Our exchange was actually able to update our system before open enrollment last year. A lot of the exchanges weren't able to do that in time, so it was a manual process. Because we had that updated system, we were able to reach out last year to folks who may have come to our enrollment system and tried to enroll, whether they did or did not complete their application and enrollment, but we recognize that they may benefit from that family glitch fix, right? We reached out to them via these direct-to-consumer channels to let them know that there is a change that might benefit them. And we're going to do the same thing again this year to really make sure that people are aware of that and haven't written this opportunity off, given that there's a significant change that could help them financially. There may be more special audiences that come up throughout open enrollment, but those are the ones that we're tracking and making plans against right now. Thank you, Marcin, for transitioning the slide. Now we're on our media schedule. This is a Gantt chart of the different types of places where you'll be seeing the Access Health CT advertising this year, starting the week of October 29th, because that is the media week. But hopefully, things will start November 1st, so people are aware. Where we're going to be is on streaming TV. Primarily on TV, our investment is a lot on the streaming because we can target this on a zip code level, folks. So anything in that dark orange as opposed to the yellow, we can actually target on a zip code level. And we're going to be in communities that index highly for the uninsured, where folks on Medicaid unwinding are, as well as, certain zip codes that I'm working collaboratively with Tammy and her team with Health Equity and Outreach, where they're having events, which again is to target these specific places where people need more of our help. We are going to be on a little bit of cable. We're going to be on Spanish cable, as well as Channel 12. Channel 12 is how we get into that Fairfield area, because they're technically a part of the New York buying for media. So we have to buy into different kind of regions. And so we're going to be there as well. And we also know that people really tune into cable right now, that some of the highest indexing programs are related to football. So we're going to be on advertising during those football games, as well as some of the key events in the Spanish community. And so we're going to be on Univision during the Latin Grammys as well. Really excited about that. We're going to be on your traditional radio as well as streaming radio. Again, we see large adoption on the streaming channels, which is why we're making a big shift from traditional TV and traditional radio to include more streaming platforms. Not only does that help us track consumer habits, but it also helps us make sure that we're positioning our money in the best way possible on that really targeted level and getting in front of the people that we need to. What's a little bit new is old this year in terms of newspapers. We're getting more value added for digital placements when we buy print. So we're actually placing a much heavier investment on the community papers, particularly the Hearst papers that are doing really well throughout our state, connecting with people on that community level, as opposed to the bigger papers like the Hartford Courant that are struggling a little bit more to reach the people that we need to reach. And what's great is by buying the print, we're getting the digital as value added. And so we're reaching people not only in the print, but we're actually getting the digital at no additional investment. And that's really how people are starting to connect with their community papers more. And so really glad to see that we're able to buy in that more strategic way now. In addition to those community papers in English, we're also buying Spanish papers as well as papers run by and for Black and African American audiences. We do have some really great out-of-home tactics. We spent a lot of time last year talking about mobile billboards, which is great. Again, that's a way that we can target on a zip code level. There might not be billboards in the certain communities we need to reach, or that billboard inventory may already be purchased, in which case we can't even get in there. And so by buying these mobile billboards, which are basically big trucks that have backlight messages, we can go and park them in certain communities in big parking lots like shopping centers, banks, things that are highly trafficked, especially during the holiday shopping season, to get attention where we need to. We'll also be on certain bus routes this year on big buses with our advertising. We have some great digital out of home where people are going to be hearing our messages at places like pumping gas, maybe when they're sitting in a doctor's office, at different grocery stores that have screens. And so we're really looking at some great digital out of home opportunities and buying those. And then we're also going to be on YouTube as well as social media and all across digital. And so by that, we mean native display and search. That's just some jargon, but ultimately it means we're going to be on search engines like Google, Bing, and Yahoo, as well as within the periphery of websites that people tend to traffic here in the state of Connecticut. The Gantt chart shows you when during the open enrollment period we'll be on each one of these media channels. We can go ahead and advance the slide, please. In terms of our creative messaging, we got some really great feedback during our focus groups in terms of tonality across the board and across different demographics that included age, race, gender, geographic location. People really want us to take a factual tone. And so we're able to make that kind of positive by saying feel good facts from Access Health CT, and that's how we're positioning our messaging this year. As we continue to grow and mature as a brand as well, people come to us for a variety of different things. They need different things from us. And so our ad campaign is going to reflect that. So in terms of our TV commercials, we actually have 5 different spots that are created at 15-second intervals, and we're buying 30 seconds of time on TV. And so you'll actually see 2 of these spots back to back that carry 2 different types of messaging, as well as informing people that open enrollment is now and what those deadlines are. So let's talk about those 5 different types of messages that really rose to the top based on our focus group feedback. The first is essential health benefits, right? This is unique to us and that you can use certain health benefits without having to pay your deductible. There's a lot of confusion out there about that. And so we want to start from a health literacy perspective, helping people understand how they can use their plan. And this is one of the things that really stuck out and surprised a lot of the people that we talked to. So we want to make sure that it rises to the top in terms of a reason to believe and a reason to look into us and to buy. The second is coverage options. So recognizing that there's different health and dental options, as well as premiums and deductibles that people can choose from. And then in the last 2 here in the list, or the second 2 here to move on to financial help and enrollment assistance. A little bit fatigued with that. That is something that every single year, including this year, our focus group participants feel is very important, and some of them didn't know. So we need to continue to hammer in those messages that financial help is only available through Access Health CT, and that it's available for the vast majority of folks that enroll with us, as well as enrollment assistance. Really providing that free online, in-person, and help over the phone is really critical for folks and helps them get through those hurdles that may be difficult in the enrollment process. And then lastly, we do have a commercial that is focused on that Husky audience to let them know that they can continue to come to us during the open enrollment period if they are affected by unwinding, right? That isn't stopping during the process. And so we'll make sure that we carry this through not only our TV spots, but this is reflective of the other things that we are using as well, such as, print and digital ads. You'll see all of these types of messages carried across those channels. And so before we advance into the next slide, where we're actually going to hear and see a little bit of our sample creative this year, I want to call a couple things to your attention. The first is deadlines. Last year, we had a really healthy dialogue about how to talk about the effectuation date change as it relates to the 2 different deadlines. And let me break that down a bit, just like my colleague Katie Hearn did, right? You need to enroll by December 15th in order to have coverage starting January 1st. If you enroll between December 16th or January 15th, your coverage is January 1st. We put all of that information into all of our ads last year, and the feedback was it was just too much to digest, and people really just focused on that January 15th deadline. As a result, what we're doing this year is through December 15th, we're having in our creative to enroll by December 15th for coverage starting January 1st. And it ends there. That's the call to action. But once January 16th starts, that call to action will flip, right, to enroll by January 15th for coverage starting February 1st, so people know that there's still an extended opportunity. So we did make that strategic shift based on our customer feedback and went into a lot of detail to arrive at that particular inclusion. Secondly, we want to talk about the actors and the locations that you're going to see. We picked some different actors. We even included some folks that have some salt and pepper in their hair, which we usually stay away from because they're a little bit older and representative of that Medicare audience. But this year, we really wanted to hammer in on the fact, especially with dental, that there's an opportunity for those folks to engage with us and make their lives healthier and better. And so for the spot where we do talk about health and dental options, we did include an actor that has a little bit of that kind of salt and pepper hair. We included all different types of ages and races. We actually had 8 different actors in our TV spots that you'll see, and then we pulled through still images through our print and other activations. And then lastly, I do want to talk about the fact that these TV spots that you'll see, we're going to see 2 sample ones in English and 1 in Spanish. There's a total of 10 spots because we have 5 in English and 5 in Spanish, but we feel like sharing a sample with you will suffice for today. But I just wanted to call out so everybody knows that these are made in both languages. And lastly, that also some of our print and radio is also produced in Polish. So we're making every effort that we can to reach across language barriers that are particularly present within our communities. So without further ado, I will turn it over to Martin to play 2 English spots. The first that you'll see is about our the essential health benefits. The second is about financial health. And the last one we're going to play for you is in Spanish, and it's about in-person health, and actually features one of our own, Karen Perez, within our Health Equity and Outreach Department, that is present and actually helping people in person, just like the creative message allows. So go ahead, Martin.
A feel-good fact from Access Health CT. Every health plan we offer includes benefits you can use without having to pay your deductible. They're a smart step to a healthier you. Open enrollment is going on now. AccessHealthCT.com. A feel-good fact from Access Health CT. We are the only place you can get financial help for healthcare coverage. That's a great way to start feeling better. Open enrollment is going on now. AccessHealthCT.com.
Un hecho positivo de Access Health CT. Ofrecemos ayuda en línea, en persona y por teléfono para inscripción en cobertura médica. ¿Tienes preguntas? Tenemos respuestas. Inscripción abierta ya comenzó. accesshealthct.com.
Thank you. Any questions before we move on?
Thank you. Great presentations. Appreciate it. I was looking for that gray hair, but
we'll tell you where you can watch them all. No problem.
Thank you.
Well, Charlie, as you know, Charlie, Medicare does not include dental, so that's why we're targeting that group.
That's a great idea. It's very good. All right, moving on. Sorry, just to marketing. To
outreach.
Health equity.
Yes.
Thank you.
Thank you. Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach. From an outreach perspective, we've been busy with multiple efforts. Every day we're working hard to build and maintain connections with our community partners and consumers, very much in person, usually by attending events, conducting on-site visits, in-person meetings and presentations. But as you all know, we've added multiple efforts to support the Medicaid Unwind. So first, we hold 2 monthly meetings, one for consumers, the other one is for community partners. For community partners, we're discussing various topics, teaching them how to navigate the website, how to find the information that they need to help consumers, right, that they're interacting with every day. But we're also gathering feedback and addressing questions or concerns that comes up. So we want to make sure that they have all the information that they need to help consumers that they're interacting with. Healthy Chats, on the other hand, is a presentation specifically designed to educate consumers about Access Health plan options, going as far as defining key terms and definitions, but most importantly, letting them know where they can find help to enroll. So both meetings will continue throughout the open enrollment period. We also still have our outreach specialists that are rotating to different community partner locations, help with in addition to the Medicaid unwinding fairs that we've been holding throughout this. Up those fairs. The last one will be held this Saturday on October 21st. And then shortly after that, we will start right back up with our open enrollment fairs starting November 4th. Next, I'd like to give an overview on our annual community conference. It was a huge success. I wanted to thank all of the community partners, certified application counselors, brokers, both carriers were in attendance, and we had some elected officials, Senator Matt Lesser, Comptroller Sean Scanlon, Representative Gary Turco, and Representative Susan Johnson. We really want to thank them all for their continued support. It was a half-day conference, 2 breakout sessions, and we covered 6 total topics. And we wanted to also thank our guest panelists, Morgan and Derek from DSS. They joined us to help discuss the unwind and immigration, which is always an important topic for our community partners, and Tanya from Health Equity Solutions for participating on a panel as well. We had 12 organizations set up tables, including our navigators, which really encouraged more networking and collaborations for everyone in attendance. So really great time for everyone. And to wrap up the conference, every year we award an organization or an individual with the Commitment to Community Award. This year we awarded the Chrysalis Center in Hartford. They've been key partners for us here at Access Health, but most importantly, they are key partners for many underserved communities and populations that they serve. So again, it was a great event and we all learned so much from each other. And to wrap up here, open enrollment is just a few weeks away. As usual, we have a lot of in-person options for consumers to get enrolled. We are hosting 19 fairs throughout the open enrollment period. And these will mostly be after hours and on the weekends to accommodate folks that can't make it into a location during normal business hours to get enrolled. And I'd like to also mention that we have a calendar on our website outlining all of the dates and times for our fairs. And of course, consumers can go to any of our Navigator locations for in-person assistance, or they can use the directory we have online to find a broker or a certified application counselor that's nearest to them. And so all of these resources can be found online. And that wraps up my presentation. Happy to answer any questions.
Thank you. Thank you, Tammy. Any questions? If not, then we are once again joined, I hope, by Julie Andrews. I see her slides here, and I haven't quite seen her yet, but to talk about the consumer impact analysis. So, Julie, the floor is yours, and thanks for joining us.
All right. Thank you, and hopefully everyone can hear me. So yeah, today we're going to be covering the plan offerings available in 2024 and how their rates are going to change and review examples of how enrollees will be impacted by these changes. If we go ahead and advance to slide 19, so enrollees will have 22 plans to select from on the exchange in 2022 and 2024. They'll have 2 fewer gold choices, and they will no longer have a platinum option. Chi-Chi will be replacing all of their plans in 2024, and they're going to be offering all new plans under a new network. The remaining metal tiers will have no net change in the number of plan offerings. On the next slide, we want to talk about the impact of the overall consumer costs. It's important to understand how metal tier election and eligibility for cost sharing reductions is a driver of a consumer's overall total cost in addition to premium. So a plan's metal tier is driven by its actuarial value as calculated using the federal cost sharing tool that evaluates all cost sharing inputs such as insurance, co-insurance, co-pays, and deductibles up to the maximum out-of-pocket to establish that actuarial value. So therefore, it can be defined as the portion of claims payable by the carrier versus the portion that's responsible by the consumer. So if you kind of look at the table on the bottom right, for example, a standard silver plan has an actuarial value about 71% for medical claim costs, and the consumer would be responsible for the balance or the 29%, while a bronze plan, the carrier would only be responsible for up to about 65% of claim costs, which is considered an expanded bronze plan. It's noted that all of the standard bronze plan offerings are considered expanded bronze plans, which are richer than just a traditional bronze plan. If you look at the graph on the left, the ACA also provides cost sharing assistance to those consumers enrolled in silver plans below 250% of the federal poverty level. Consumers that qualify may be eligible for reduced cost sharing, lower co-pays, co-insurance, and deductibles, thus increasing their standard silver actuarial value from around the 71% I mentioned earlier to almost 73%, 87%, or 94%, as represented by the light blue portion of the graph. This information and this cost sharing is independent of any state program, such as the Covered Connecticut program cost sharing. So on this plan, the provides a snapshot of metal level selection by enrollees throughout the years. The left four columns show the metal selection for on-exchange enrollees by year. In 2021, we started seeing a reversal of the prior year's trend with an increase in the silver plan enrollment that has continued throughout 2023. As part of this shift, this is the third year in a row then that we're seeing a decline in the bronze enrollment. And I think, a big portion of it is the result of the impact of the enhanced subsidies that were legislated through the passage of ARPA and the Inflation Reduction Act in 21 and 2023. The right four columns show what percentage of enrollees in a metal plan elected the lowest premium plan option available to them that year. Given that the results are less than 100%, we can conclude that other factors were considered by enrollees than just the premium costs when selecting their medical coverage. On the next plan, so while we did focus on the individual coverage primarily for the analysis, we did review the small group plan offerings and changes on the exchange. So one issuer will be participating in 24 and they will be offering the same plans as 2023. Anthem, the participating carrier, has an average increase in their premiums of about 5.1%, with premiums varying in increases from about 0% to 11.7% for the 5 plans. Going forward, let's go ahead, next slide. So in this section, we're going to focus on the rate changes that were approved by the Connecticut Insurance Department for 2024. So rate increases for enrollees continuing enrollment in their current 2023 plans will experience an average increase of about 8.5%. Enrollees in Anthem and CBI will see single-digit increases on average, while Chi-Chi plans will increase 10.6%. Rates will vary widely by plan and by county, from a small decrease of 1.8% to an increase of about 27.3%. On the next slide, there's several drivers that have contributed to the average 8.5% premium increase presented on the prior slide. For 2024, though, COVID is playing a much smaller role in driving anticipated healthcare costs. Rates were actually adjusted downward approximately 1% to reflect the lower anticipated cost in 2024 for COVID as compared to the 2022 base year prior experience period. The largest driver of increases for 2024 were emerging experience for the various carriers, as well as anticipated pricing trends into 2024. So the bottom table contains loss ratios by carriers and overall for the state for the past 4 years for all on and off exchange carriers and plans. The ratio sort of reflects the ratio of claims to premiums, and reflects the emerging experience for 2022. The overall average loss ratio is 92.1% statewide, which means that out of every premium dollar, about 92 cents were spent to pay claims, while the other 8 cents were left to cover on hand to cover everything else, such as administrative costs and investments for the future. In this way, the loss ratio also acts as a gauge for the health of the insurance market, where one can observe claim costs, where if premiums have been sufficient to cover the cost of claims and contribute to the cost of administration while not being excessive. So 2022 experience was used as the base period experience in developing the 2024 rate increases for all the carriers. On the next slide, you can see all of the rate changes by carrier, metal plan, and county going for continuing plans from 2023 into 2024. Chi-Chi and Anthem did make changes to the regional rating factors for 2024, so that's why you'll see different changes by county. If we focus in on the 3 silver plans within the light blue box, Anthem Silver Premium is decreasing by 0.1% for Fairfield County, while CBI is increasing 11.4% and Chi-Chi is at 4.8%. So this is important to focus on the silver premiums as they are used to determine the benchmark premium for subsidies, which will be discussed further. The next slide shows the remaining bronze and catastrophic plans by plan and county. So if we go ahead and advance another 2 slides, we're going to focus in on the actual impact to consumers. So when consumers make a decision, which plan to select, there are many considerations that go into that decision, such as plan design, network, or healthcare needs. The analysis is only going to focus on the directly measurable impact to consumers in the premium and federal subsidies on consumers. And then brokers are well positioned to advise consumers on needs and plan selections. In addition, the decision support tool may help consumers negotiate their shopping experience by assisting in evaluating their premiums and estimating their healthcare costs for the upcoming year as they apply for coverage. On the next slide, the premium consumer impact analysis uses carrier plan mappings for any discontinued plans, and any weighted average calculations that are shown are based on exchange enrollment as of September 2023. On the next slide, I just want to provide some important definitions of components that are used in evaluating the consumer impact of premium changes. The benchmark plan is defined by the second lowest cost silver plan for essential health benefits only. The benchmark plan and the plan selected by the consumers define the advanced premium tax credit paid by the federal government and may be referenced as the subsidy. We also want to recognize the Covered Connecticut program that will impact consumers' cost sharing and premiums, but this has not been reflected in the analysis that we've done. On the next slide, there are several drivers that can impact a consumer subsidy from year to year, with the benchmark premium plan being a key driver. The benchmark premium plan is changing in 5 out of the 8 counties, and these changes will vary from about 1.3% to 11.4%. All right, this table presents the change in the benchmark plan and the percentage change by county. We're also showing the September 2023 enrollment by county used in developing the weighted averages. The benchmark premiums are increasing and changing in all but 3 counties, and the dollar impact of these changes will vary by the household, income level, county, etc. So on the next slide, now we're going to transition to a detailed consumer impact on a sample household made up of a single individual. So our sample consumer is Michael, who is 44 in 2023 and whose income is 300% of the federal poverty level. For this individual, benchmark premiums are increasing 9%, which includes the increase due to aging, given that Michael will be turning 45 in 2024. So on the next slide, we can see some more greater detail. So if we focus in on Michael's example in Fairfield County, his benchmark premium is increasing $63 or 8%, reflecting his older age as well in 2024. His subsidy is increasing by a similar amount, about $49 or 9%. The result is that his net premium in the benchmark premium will increase $13, so from $206 to $219. The analysis assumes Michael would change plans in these counties where the benchmark plan differs as it does in Fairfield County. As noted previously, New London, Tolland, and Windham counties will not have a change in their benchmark premium plan. And the next example, the next two slides that I'm going to show are additional shopping scenarios following Michael through enrollment in the lowest cost silver plan and the lowest cost bronze plan offering. So let's start off with the lowest cost silver plan offering. The lowest cost silver plan is changing for all counties from 23 to 2024, except for New London, Tolland, and Windham, as shown. The premium for the lowest cost silver plan in Fairfield County is increasing by 15% or $105. The result is a net premium increase of 35% or $56. Since the lowest cost silver plan is remaining unchanged in Fairfield, there's no shopping opportunity. But if Michael lived in Hartford, for example, he could switch to the silver PPO standard pathway plan in 2024 and reduce his net premium by $14 from $221 to $207. On the next slide is the lowest cost bronze pricing shopping scenario. The premium for the new lowest cost plan in Fairfield County will be higher by 13% or $78. The result is a net premium increase of over 34% or $29. The lowest cost bronze is not changing in Fairfield County, but enrollees in Middlesex County, for example, could switch plans to save $6 in net premium. Lastly, I'd like to present, next slide, two more examples, though not as detailed, to demonstrate how consumers can be impacted differently and the varying options they may have to mitigate any increase in premiums. So for example, we're going to talk about Ted, who is currently 28 and has income at 200% of the federal poverty level. Ted is currently enrolled in the lowest cost silver option, and he is eligible for cost sharing reductions based on his income. So on the next slide is the example for Ted. So Ted's current premium is $12 in 2023. If he does nothing and auto renews into the same plan, his premium will go up $36 to $48, which is shown on that green bar second column. Ted could switch to the lowest cost gold plan, which would have a minimal impact on his premium as the two plans. But because Ted is eligible for cost sharing reductions, moving from his current plan at the approximately 87% actuarial value to the gold plan at an 80% actuarial value would mean higher cost sharing in the form of copays, coinsurance, and deductibles. Using Wakely's proprietary database of individual ACA claimants, we have found that a consumer like Ted would have monthly out-of-pocket costs of $69 in a gold plan, which is $54 more a month than in his current plan. Likewise, Ted could switch to the lowest cost bronze plan, reducing his premium to only $1, but similar to the gold plan scenario, enrollment in the bronze plan would mean more out-of-pocket cost sharing, and in this example, $52 more per month. On the next slide, we're going to talk about Karen, who is currently 55 and has an income in excess of 400% of the federal poverty level. She's enrolled in the lowest cost silver option available. Prior to the passage of the American Rescue Plan Act and the Inflation Reduction Act, Karen would not have been eligible for subsidies at an income level of 400% of the federal poverty level. So on the next slide, we can look at Karen's scenario in more detail. Karen's premium after subsidies at the beginning of 2023 is $393. If she does nothing and auto renews into the same plan, her premium will go down $5 to $388. Karen could switch to the lowest cost gold plan, which would reduce her current premium by $45 to $348. Karen would also benefit from the richer actuarial value of the gold plan at an 80% actuarial value as compared to her silver plan at a 70% actuarial value. Karen's not eligible for cost sharing reductions, so her monthly out-of-pocket healthcare costs would decrease by $15 from the $114 to $99 as shown on the bottom row of the table. Karen could switch to the lowest cost plan, reducing her premium to only $219 per month, and her cost sharing would obviously increase by moving to the less rich bronze AV at about 65%. But the impact is minimal, and the combined net premium and estimated monthly out-of-pocket costs would be $342, which is the combination of her premium of $219 and $123 estimated cost sharing. And so it would be a lower total cost as compared to the other options. There are, of course, many considerations that would go into Karen's plan choice decision besides costs, and Karen should work with her broker or utilize the decision support tool to weigh the best option for her in 2024. Now, I know I've only shown a few options. There are additional options, families and couples shown in the fuller report, as well as additional information about average out-of-pocket costs per month. And that is the end of the consumer impact study. Are there any questions?
Charlie, if we have not sent the support to the board, it will be forwarded shortly to the entire board.
No, that would be great. I appreciate that. Julie, this is very, very helpful information. Do the brokers have the information? One thing that strikes me on this, Julie, is that the premium increases can go up, but the net out of pocket can go down for some people, and that's not surprising. Do people their brokers have enough support to sort of help them see all the way to your bottom line in these decisions?
I'm not aware fully of what they may have as far as estimating cost sharing. They do, have the details about the actuarial value and understanding that information. And I understand that the decision support tool has additional detail to help navigate that information that the brokers also have access to.
So Charlie, this is why every year, every broker on the exchange has to get recertified by us. So they're going through an extensive training. That training gives them all of the updated information that they would need to support their clients.
And also, sorry, my apologies,
please,
Charlie.
Susan.
This is Susan. We'll be posting the full report as well on our website. So, and we'll let the brokers know. So it's there. I think probably the most of interest to them would something that they maybe don't have from other sources is the information Wakely has from their database with claims to know the cost sharing as you're talking about.
No, that's super helpful. Terrific. Any other questions? Julie, again, thank you very much for joining us. As always, very informative. We appreciate it.
Thank you.
Susan, I think amazingly, we actually give you 5 minutes here. So
I know. We tried to avoid what usually happens, so we sent out the summary to everyone. So I can take any questions if anybody has it. We included information about the Medicaid unwind, and CMS's activity during this time. We're still waiting the Braidwood versus Becerra case on the preventative services mandate. Briefs have been filed and there's a stay in place, but we'll keep following that. And then I just included a note if anybody was curious about the proposed rule that had come out last spring on to expand eligibility for DACA recipients. Unfortunately, hasn't been finalized at this time, so it won't go into effect yet, and we'll just keep watching to see, what happens there.
Thank you. Any questions? James, the last word?
No, I'm just, again, I would ask the board members to leverage your network to announce the fact that open enrollment starts on November 1st. We'll run through January 15th. If you need any information from us, please reach out to me or anybody on my leadership team directly. If you need us to be somewhere to do a presentation, Tammy and her team are well prepared and ready to do that as well. So again, we're off to a very good start. We're looking forward to best open enrollment yet. Now, one thing I want to add is right now our enrollment numbers for 2023 stands at north of 115,000. This is the highest we've ever been this late into the year. So people come in and out throughout the year. By this time, we're normally in the 95, 96,000s. And now we're at 115,000. And we know the biggest driver of that is Cover Connecticut, as well as the Medicaid unwind. As people come off Medicaid, they're coming to Access Health to continue the coverage.
Terrific.
Thank you.
Terrific news. All right. Marcin, before I call for a motion to adjourn, are there any other questions or comments? I wonder if I could have like 30 seconds after we close the meeting, just with the directors. That would be helpful. So, Marcin, let us close the meeting. Can I have a motion to adjourn the meeting?
Yeah, motion to adjourn. This is Grant.
Thanks, Grant. Second?
Second.
All right, thanks very much. This is Charlie Klippel, yes.
Okay, thank you. Paul Philpott?
Yes.
Kron Ritter?
Yes.
Deidre Gifford?
Yes.
Steven Hernandez? Matthew Brackman? Thomas McNeil? Angie Barton Reeves?
Yes.
Thank you. Sean King?
Yes.
And Claudio Gualtieri?
Yes.
Thank you. Meeting's adjourned.
All right, meeting adjourned.
So, Charlie, I assume you want the staff or
I just to end the recording, and so a quick note to my fellow directors. Thank you for joining me tonight. If you can join me tonight, and if you can't join me tonight, if you find that you can, please do. Very informal. So if you can, I'd love to see you. And 6 o'clock. Thanks.